One of Europe's leading hospitals has launched a campaign to fund a piece of equipment with the potential to cure more cancer patients. The Yorkshire Cancer Centre in Leeds is calling on people across the region to help raise the £2.4 million needed to buy an MRi simulator. The cutting-edge piece of technology is set to become a major new weapon in the treatment of cancer by offering a much more targeted use of radiotherapy. Professor David Sebag Montefiore explained how the new scanner would benefit patients.
The MRi Sim Appeal provides the opportunity for us to go to a significantly higher level of excellence for radiotherapy treatment for patients receiving radiotherapy at Leeds Cancer Centre. At the moment, when we plan radiotherapy treatment, we are using CT scans and we see fuzzy grey. What we can do with an MRI scan is see absolute black and white. We can see our target so much better. This would allow us to provide much better targeted, higher quality radiotherapy. It would allow Leeds to go to the highest level of excellence.
Radiotherapy is used in around 50% of patients as a curative treatment for cancer, and it is a treatment where radiation is used to kill the cancer cells.
We use CT imaging as the standard for radiotherapy treatment planning. However, we want to improve the way in which we plan radiotherapy treatments, and MR or magnetic resonance imaging is a way in which we can do that.
This is a typical cross-section CT of a patient, that's a brain area, and this is the MRI, and straight away you can tell the difference between the quality of the two images. On CT you can see it's very grey, whereas it's more detailed and with finer structures that can be probably easier to identify.
The potential for saving lives is enormous. More accurate radiotherapy planning spares healthy tissue, so only the tumour itself is being irradiated, so it's not just about saving lives but also improving the quality of life for patients.
The new scanner will be located in the hospital's Radiotherapy Department, which currently treats 7,000 patients a year and sees 400 people pass through its doors every day. Dr. Anne Henry, Associate Professor for Clinical Oncology at the hospital, explained the significance.
We hope that by having the MRI scanner in our department, it will mean that patients don't have to wait as long and they'll be able to undergo their imaging in preparation for the radiotherapy much faster and much more conveniently. In the longer term, this will mean that we'll be able to cure more cancers and reduce the side effects of treatment.
The opportunity to have an MRI simulator that's placed very close to where the radiotherapy treatment is delivered would be a huge bonus for patients. At the moment, the MRI scanners are in other parts of the hospital or other parts of the trust, and what we want to do is provide the MRI simulator in the same place that patients come for treatment to make it the most convenient and most beneficial to them.
By incorporating and having an MRI scan within our department, we could develop clinical protocols that then could be disseminated to other UK centres.
Among those who've already started raising funds is Sophie Marie Webster, who underwent treatment for cervical cancer earlier this year.
Since I've finished my treatment in July, I've raised about £1,000 so far and hopefully be raising a lot more. I just feel I want to give something back to the hospital because the care that I've had whilst I've been here has been excellent.
We're extremely grateful for all the support that we've enjoyed over the years for our various campaigns and appeals. We're coming to you yet again in the hope of purchasing a wonderful new piece of equipment for Leeds Cancer Centre. This will cost £2.4 million, which is, I know, a huge ask. But with your support, yet again, I'm confident that we will raise these funds in no time at all, funds that will benefit directly our cancer patients here at Leeds Cancer Centre.
We are already recognised as being a leading radiotherapy centre, but the MRI simulator will take us to an internationally leading level. We will be able to use this type of scan to provide the best quality treatment for patients and greater targeting, and the aim of that would be to improve the cure rates for cancer.